What if I told you that the very medication sitting in your bathroom cabinet right now, the one your doctor prescribed to keep you healthy, could actually be sabotaging your sex life, and you probably have no idea it's happening? I'm Dr. Emily Carter, a urologist and men's health specialist, and today we're going to talk about something that affects millions of seniors, the hidden side effects of the pills you take every day. Because here's the truth. Many of these medications are essential for survival. They lower blood pressure, protect your heart, balance blood sugar, or reduce cholesterol. But at the same time, they can quietly drain your energy, dull your desire, and make it harder to stay intimate, even when everything else in your relationship feels right. And the most shocking part? One of these medications is taken by over 100 million people every single day. So in this video, I'll walk you through the 5 most common drugs that could be harming your sexual health, why they do it, how to recognize the warning signs, and what you can safely do about it. Because you should never have to choose between being healthy and feeling alive. Before we talk about which medications are the culprits, you need to understand how an erection or arousal actually works. It's not just about what happens down there. It's a full body process. Your brain, your hormones, your nerves, and your blood vessels, they all have to work together like a symphony. First, they can limit blood flow. Think of your blood vessels as flexible garden hoses. When a drug reduces pressure or constricts the walls, less blood can reach the tissues that need it. And without proper circulation, it's like trying to inflate a balloon through a kinked hose. It just doesn't work. Second, some medications affect your nerves. Your brain sends out signals, but the message gets interrupted on the way down. That delay, even if it's just a split second, can completely disrupt the rhythm of arousal. And as we age, our nerve sensitivity naturally declines, so even a small disruption can have a big impact. Third, certain drugs alter hormones. Testosterone, in men and even in women, plays a key role in sexual desire and satisfaction. Some medications can lower these hormone levels or block how your body uses them. And when desire drops, so does performance. Now here's the real kicker. In the United States, about 60% of adults take at least one prescription medication. And for seniors, that number is much higher, often 5 or more pills a day. Each one may be doing its job, but together they can add up to something you never expected, a quiet, gradual decline in your sexual health. But don't panic, because knowing why this happens is the first step to taking back control. Next, we'll look at the 5 most common medications that could be affecting your sexual function. And I guarantee at least one of them is probably in your medicine cabinet right now. Let's count down the 5 most common medications that may be quietly affecting your sexual health. And trust me, number 3 is going to surprise you. Number 5. Atenolol. This is a beta blocker, one of the most common drugs prescribed for high blood pressure and heart problems. It works by calming your body's fight or flight response, slowing your heart rate, and reducing stress on your arteries. That's great for your heart, but not always great for your sex life. Because when your nervous system slows down, your blood vessels also become less responsive. They don't open as easily, and blood doesn't flow where it needs to go. Imagine trying to fill a balloon through a half-closed valve. It just won't fully inflate. That's exactly what happens inside the body. Studies show that up to 1 in 4 men who take beta blockers report some form of erectile dysfunction. Now, that doesn't mean you should stop the medication. Far from it. But if you've noticed changes in your desire or performance since starting it, talk to your doctor. There are safer alternatives like ACE inhibitors that may protect your heart without affecting your intimacy. Number 4, simvastatin. You've probably heard of statins. They're powerful cholesterol-lowering drugs prescribed to millions of adults every year to prevent heart attacks and strokes. But here's the catch. Cholesterol isn't all bad. Your body actually uses cholesterol to make hormones, including testosterone. So when you lower it too aggressively, especially with high doses or long-term use, your testosterone can drop as well. Low testosterone means low libido, less energy, less drive, less spark. Now, this doesn't happen to everyone, but if you've been on a statin for years and notice fatigue or loss of interest, it's worth checking your hormone levels. Sometimes adjusting the dose or switching to a different statin can make a world of difference. Number 3, aspirin. Yes, aspirin. That tiny pill that millions of people take every day to protect their heart. Recent studies suggest that daily aspirin use may interfere with nitric oxide, the chemical signal that tells your blood vessels to open up during arousal. Think of nitric oxide as the ignition switch for an erection. Without it, nothing starts. If you're taking aspirin every day and notice a gradual change in performance, don't panic. The benefits of aspirin, preventing clots and strokes, are still incredibly important, but you should discuss it with your doctor. Sometimes, changing the timing or adjusting the dose can help minimize this side effect. Number 2, atorvastatin. This is another statin, and it works the same way as simvastatin, by lowering cholesterol. It's one of the most prescribed medications in the world, especially for seniors with high cholesterol or heart disease. And while it's extremely effective at preventing cardiovascular events, it can also lower hormone production in some men and women. That means less testosterone, less desire, and a slower recovery after intimacy. But remember, uncontrolled cholesterol is far more dangerous than a lowered sex drive. Heart attacks, strokes, and blocked arteries can be life-threatening. So again, don't quit, adjust. Ask your doctor if another statin might work better for you, or if lifestyle changes could help you lower your dose safely. And finally, number 1, metformin. This one is tricky. Metformin is the frontline medication for type 2 diabetes, and it's one of the best tools we have to control blood sugar. It saves lives. But here's what many people don't know. Metformin can reduce your body's ability to absorb vitamin B12, and B12 is essential for healthy nerve function. When your nerves don't communicate properly, sexual response becomes dull, slow, or inconsistent. You may still have desire, but the signal from your brain to your body gets lost on the way. Metformin can also lower testosterone in some people, which adds another layer to the problem. Now, should you stop taking it? Absolutely not. But you should ask your doctor to check your B12 levels regularly and supplement if needed. It's a simple fix that can protect your nerves, improve energy, and even support sexual health. Now that you know the 5 medications that can quietly interfere with your sexual health, let's talk about what you can actually do about it. Because the last thing I want you to do is walk to your medicine cabinet and throw everything away. That could be dangerous, even life-threatening. These medications are prescribed for a reason. They control blood pressure, prevent strokes, manage diabetes, and save lives. So here's the truth. It's not about quitting your medication. It's about working with your doctor to find a better balance between treatment and quality of life. Let's take it step by step. If this video helped you, share it with someone you care about, a friend, a partner, or a loved one who might be going through the same thing. Because sometimes a single conversation can change a life. Remember, knowledge is power, And awareness is the first step to taking back control of your health, your energy, and your happiness. If you'd like to see more science-backed videos on senior health, vitality, and intimacy, make sure to subscribe and tap the notification bell so you never miss what's next.